Hi guys! Today I'm going to be talking about ADHD. We've all heard of it, especially in reference to kids. But what exactly does it mean? ADHD stands for Attention Deficit Hyperactivity Disorder. The most common type is a combination of inattention and hyperactivity, both lasting for at least 6 months. As the name implies, these kids are easily distracted and they have lots of energy. Their actions are random and impulsive, and they can kind of be described as bouncing off the wall or perpetual motion machines. It's common for these kids to get frustrated easily. So, as far as diagnosing this disorder, usually we don't notice a problem until these children enter school. ADHD is far more common in boys, with a ratio of between 2 and 4 boys to 1 girl. In 60 to 70% of these cases, ADHD will continue into adulthood. According to Mary Townsend, in her book Essentials of Psychiatric Mental Health Nursing, numerous studies suggest evidence that genetics heavily contribute to the cause of ADHD. Parents who are hyperactive as kids are more likely to have hyperactive children. Pregnancy may also play a role, as studies have linked smoking during pregnancy to impulsive behavior in offspring. Exposure to other toxic substances, such as alcohol, have been linked to hyperactivity and inattention. Causes of ADHD can also be traced to environmental influences. Studies have provided strong evidence that there's a connection between abnormal behavioral development and elevated levels of lead in the body. Although the government has placed tighter restrictions on lead in the past few years, like pencils and household paint, small amounts can still be found in soil, water pipes, household dust, and pottery. Another quite possible contributor to ADHD is that of food dyes and additives. Just go to the grocery store and you'll find that artificial flavorings and preservatives are absolutely everywhere on the labels of processed foods. Fruit snacks, jellos, crackers, puddings, cookies, everything kids love. You name it, it's got the artificial stuff. So further research is currently being done in this area to explore possible connections. And finally, what is being done for kids who are diagnosed with this issue? Treatment for ADHD includes the use of medication, including acetaminophenes or CNS stimulants. This type of medication increases the level of norepinephrine, dopamine, and serotonin in the central nervous system, producing a therapeutic effect in the treatment of ADHD. It's also important to therapeutically interact with these kids. Some techniques you can use are to first develop a trusting relationship. You also want to provide simple, concrete instructions for the kids and reduce environmental distraction, helping them to focus and concentrate on the task at hand. You also want to encourage and reward independent achievement. The goal is for these kids to remain safe, develop trusting relationships with caregivers, and interact appropriately with peers. Goals should also include seeing cooperative behavior and verbalizing positive statements about themselves. It's important to interact in a therapeutic way with these children and be sensitive to the fact that they need extra guidance. Well, I hope you guys have learned something today about ADHD in kids. Thank you so much for watching, and I'll see you next time.